Thank you for the opportunity. The topic I am going to cover is the recent advances in pharmacotherapy for glaucoma management. We all know glaucoma is a chronic progressive optic neuropathy and the leading cause of irreversible blindness. And the single most important modifiable risk factor is the control of intraocular pressure. Glaucoma is a growing concern, and 80 million people affected by 2020, and this figure is going to increase to 112 million. That is increase of about 32 million by 2040. But unfortunate part is that in India, 12 million people are affected, 1.2 million people are blind from the disease, and more than 90% of these cases remain undiagnosed. But we have come a long way as far as pharmacotherapy of the glaucoma is concerned. About 1876, we had a drug like pilocarpine. 100 years later, we had beta blockers in 1978. Then we had in 1987 alpha agonists like brimonidine. Then carbonic anhydrase inhibitors. 1996, we have prostaglandin analogs. 2017 saw the advent of Rho kinase inhibitors. So where is the need for newer drugs when we have so many drugs in our armamentarium? We want drugs with improve the health-related quality of life, which offer neuroprotection. Patients have known allergy or side effects to the existing drugs. We want drugs with longer half-life, more potent, lesser side effects, and there is also need for preservative-free drugs that are economical. So there is advent of these kind of drugs like latanoprostin bunod 0.024% and ROCK inhibitors with prostaglandins, and all of these drugs are still not available in our country. So what is new in the medical management? There is drug like latrancolin B, which causes mean reduction of intraocular pressure of 32% to 34%. Drugs like nitrogen monoxide donors like latanoprostin bunod. Why they are effective is because these nitrogen oxide synthetase, they relaxes the trabecular meshwork cells and inner wall of the Schlemm's canal, besides increasing the uveoscleral outflow and also increasing the ocular blood flow. And what is the efficacy? They cause more reduction in intraocular pressure compared to the prostaglandins like latanoprost. And there are studies like Lunar and Apollo which have demonstrated that latanoprostin OD dosage was non-inferior to timolol. And another study, Voyager, has concluded that latanoprostin bunod 0.024% had better IOP reduction than latanoprost. So that is, it shows more efficacy than prostaglandin analogs. Coming to the PGA analogs, we all know that the first prostaglandin that was approved by FDA was latanoprost, next was bimatoprost, and then in 2014 we had tefluprost. We all are aware that there are 9 types of receptors that have been identified for prostaglandins in the human body, and these are PGFP and PGE receptors. These are 2 main types of receptors present in the human eyes, and they are mainly located on the Schlemm's canal and trabecular meshwork. But there are exciting future developments in PG analogs, and these are that the only drugs approved right now are for PGF2 receptors, and current research strategies are focused on targeting PGE2 and PGI2 receptors. Like latanoprostin bunod is a PGF2 analog, sulprostone and butaprost are PGE2 and PGE2 agonist, and iloprost is PGI2 analog. Then we have sustained release implants like bimatoprost sustained release implant, which delivers drugs over 4 to 6 months. There is travoprost intracameral implant, which again is efficacious over the period of 4 to 6 months, achieving IOP reduction of 30%. BKC-free drugs are again the need of the hour because over 70% of existing multi-drug formulations contain benzalkonium chloride, and they promote inflammatory markers. So they cause delayed hypersensitivity and allergic reactions, and 40% of glaucoma cases are also associated with ocular surface disease, and hence BAK-free products are now considered as preferred choice. These are some of the BKC-induced allergic reactions. So there are technologies like self-dispersion nanotechnology, where the drug is surrounded by oil and non-ionic stabilizers. Then this was talked to by Dr. Vinita Gupta and Dr. Shweta also, that there is now technology in the horizon where there is a real possibility of detection of apoptoizing retinal ganglion cell, and ANX776 has been is a marker with which we can detect these apoptoizing retinal ganglion cell. And imagine when you are able to detect this apoptoizing retinal ganglion cell, There is another drug which has been tried in transgenic mouse line, that is apoptosis inhibitor. Diagnose apoptosis, apoptizing ganglion cell, and give apoptosis inhibitor so that the glaucoma, even at pre-perimetric stage, is really taken care of. Gene therapy has also been talked about. The trabecular meshwork is a favorite tissue for gene transfer. Lax Z reporter gene, caveolin 1, caveolin 2, angiopoietin-like 7 are some of the genes which are being now talked about as far as the gene therapy for glaucoma is concerned. But the current IOP, if we talk about IOP lowering medication, they currently have drawbacks. That is, none of them are acting against the real mechanism, pathophysiology, that is increased outflow resistance. Then beta blockers and alpha agonists do not act during nocturnal period, and many patients are unable to tolerate because these drugs because of the side effects. So need of the R is agents with a novel mechanism of action which are effective during both diurnal and nocturnal periods, and which also support retinal functions and which have minimal side effects. So that saw the advent of drugs, newer class of the drugs like Rho kinase inhibitors. And Rho kinase inhibitors, how do they act? They act at subcellular level. I'll just explain this slide. You will find that at the margin of the trabecular meshwork cell, you have actin-myosin complexes. And these myosin-violet complexes, when they get aggregated, they cause rounding of the tip of the trabecular meshwork cell. And so what happens is, at subclinical, subcellular level, the outflow resistance, that is the pore size in the trabecular meshwork, increases and the outflow resistance decreases. So the ROCK pathway mechanism is just taken care of. So I'll just conclude that the ripasudil and netasudil are some of these drugs which are the cannabinoids, melatonin, connective tissue growth factors. All of these have been talked about. Neurotrophic factors in the neuroprotection. So the future looks exciting. Although the currently lowering of IOP remains the only treatment strategies, but the sustained drug delivery system and personalized medicine, which really take into account your genetic makeup and then targets with the gene therapy, is maybe the newer future. And newer medications may be able to extend the duration of medically controlled glaucoma. Preservative-free drugs may help in preserving ocular surface, and alternative methods of delivery for glaucoma medications may be a key factor in improving outcomes with currently available medication. Thank you.